Okay, great. Good afternoon, everyone, and welcome back to part 3 of the Healthy Northeast Ohio webinar series. This was our first time doing a webinar series, so we're very excited that we had attendance for this and that you all took some of your time to join us for all of our different sessions with all of our guests. So we thank you for being here. We are going to get started. I'm going to start off with a couple of brief introductions. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio. Sarah, would you like to introduce yourself?
Sure. Thank you, Libby. Good afternoon, everyone. Thanks for joining us. My name is Sarah Zabo, and I am a data analyst at the Cuyahoga County Board of Health, and I serve as the data analyst for Healthy Northeast Ohio, as well as one of the website administrators.
Thanks, Sarah. And I am with the Center for Health Affairs. I don't think I mentioned that, so just thought I would add that in there. And we are going to move right along. Over the next half hour or so, this is what you can expect. We are going to provide a brief overview of information about who we are here at Healthy Northeast Ohio, all of our efforts, and then Sarah will move into all things data. You'll hear a little bit about data related to community conditions that's available on the site. After that, we're going to move into our partner discussion. We are very excited today to be joined by Dr. Darcy Friedman from Case Western Reserve University. Dr. Friedman will be sharing information about food insecurity needs and opportunities here in Cuyahoga County. And then we will be sure to leave a few minutes for Q&A. As questions may arise during the different talks and during the different presenters, please do feel free to add those to the chat box. And again, if you could address them to all panelists so that we can ensure that we see those, that would be great. To provide you with a little bit of background information. Again, I know many of you are returning users, many of you are familiar with our efforts, but for those who are new, we did want to provide just a brief overview. So we did launch in 2019, so we actually just had our second birthday for healthyneo.org. We currently maintain a presence in 9 counties across the Northeast Ohio region, and Ashland County and Geauga counties were the most recent additions to that list, so we welcome them. We are grant funded by a grant through the Health Comp Foundation, and we also receive partner contributions to support this work. To briefly wrap up our overview, here are just some quick points about, again, who we are, what the platform serves to do. Today, we are going to be discussing community conditions. As some of you may recall, earlier this year, we conducted a survey, and during that survey, topics such as food insecurity, transportation, housing were all brought to our attention as areas of interest. So with that, I'm going to turn it right over to Sarah, who's going to explore some of our data resources.
Thanks, Libby. Okay, give me a moment just to share my screen. Libby, would you mind confirming that you're seeing the website?
I am seeing healthyneo.org.
Okay. Perfect, thank you. Okay, so we know our time is brief today, but we did want to take just a little bit of time here to go over, again, as Libby shared, some of the community conditions related data that we have available on the site. So if you haven't been to the website, this is the homepage. I'm mainly going to be just focusing on the Explore Data tab today. But again, just highlighting some of our data around, economic stability, food insecurity, transportation, and housing. And then I'll show you 2 of our data related tools. So first I wanted to take you to the indicator list by location. And again, if you've been to the site, this will be kind of a recap, but as Libby shared, the website has 275 health and quality of life indicators that come from more than 30 sources, including a variety of state, national, and other sources. And most of the data is maintained by our vendor, which is Conduent Healthy Communities Institute, with the exception of some local data that we have added to the website. And we do have data for 9 counties in the region, as well as the cities, zip codes, and census tracts that make up those counties. And if you are new to the website, I would recommend you checking out this page as it lists all of the indicators that we have available and by what geographies over here to the right. So another way that you can search for data on the website is using, under the Explore Data drop-down, this Search for Data page. So on this page, you're able to do a keyword search. You can use these drop downs to select a specific indicator or a specific location. So I'll just do a keyword search for the sake of example. So what you would do is type in your keyword search, and then here, this is showing all of the indicators that are related to my keyword search of poverty. So I'll just scroll a little bit. So the website will show you all of that, the available indicators there. And then I'm going to go ahead and just pick one for the sake of example. So say I was interested in learning more about people living below the poverty level. I would just click on that indicator, and then this box will pop up that will prompt you to select a location. So I'm going to just go ahead and select Ashtabula County. Hopefully it won't take too long to load. Okay, so now we are at what is called the indicator detail page. So this is where you can really dig in to learn more about the specific indicator you've selected. So up at the top, you're going to see the indicator name. So again, people living below poverty level. You're going to see the location that you selected, as well as the current measurement period. And then there's text about the indicator, as well as why it's important. And then just below that, you're going to see the current value for Ashtabula County, and you can read more about the source and who maintains that data just below that value. The website does have a lot of gauges and dials and colors that it uses for various comparisons that it shows. So to the right over here are any comparisons that are available for this particular indicator. So here you can compare Ashtabula County to other counties in Ohio and even across the country. You can compare it to the state or US value, even looking at how this indicator might be changing over time. And then also, if it's available, if this indicator is meeting the Healthy People 2030 target. Just below that, you're going to see a couple graphs. So it looks like this indicator does have breakout data available by gender and race and ethnicity. If those weren't available, you would only just see this change over time graph. And I wanted to mention that you can download all of the graphs on the website just using this 3-bar symbol up at the very top right-hand corner. And then if I scroll a little bit more, there's also maps that are available for these indicators, and you can use these tabs up here to look at different geographies. And then at the very bottom below the data table, you can also download indicator data to use, and you just click this download county indicator CSV option. And then one cheater tip is if you're looking at these different comparisons, if you see them as I'm hovering, some text will show up just to help you interpret that. And then we also on the very left over here have this see the legend option, which you can also check out. So again, just quickly wanted to show you how you can search for data on the website and just highlighting that keyword search of poverty. I also wanted to mention that we do have several specialty dashboards on the website, and just for time's sake, I'm not going to actually show any of them. But these are available in addition to, all of those 275 indicators. So we do have a demographics dashboard. This includes 250 demographics variables that are available at the state, county, and zip code levels. And there's a bunch of different data visualizations that are available to you to download in that specialty dashboard. We also have a disparities dashboard. So that's going to show any indicators that have subgroup data that's available by race, ethnicity, age, and gender. And then of special interest today is we also have a food insecurity index, which is a newer tool that was created by our vendor Conduent HCI that can be used to identify areas in your community that are estimated to have the highest food insecurity. And that has a map. So again, please feel free to check that out. And then we have a socio needs index, which is another tool that was created by Conduent that can be used to help identify under-resourced communities by county, zip code, or census tract. And then the last one, which I sort of alluded to, is we do have a Healthy People 2030 progress tracker. So any indicator that has a target available, you can see if it's being met or not. And then, as I mentioned, I also wanted to just quickly highlight 2 of our data-related tools that we have available. So let me just click on my next tab here. So this is the option to build a custom dashboard on the website. To do that, you would just go to Explore Data and then build a customized dashboard. So here I have created a custom dashboard looking at different transportation-related indicators specifically for Lake County. Excuse me. So these dashboards allow you again to see a summary of the indicator and then any of those comparisons that are available. And these dashboards are dynamic, so as the data is updated on the site, your dashboard will be updated. And these can also be easily saved and shared with others. If you just look right under search results, if you click save a link to this search, you can go ahead and just copy that and email that to someone, or even save it for your own purposes to come back to this. And then the last thing I wanted to mention, again below search results, is that there's two ways that you can look at these dashboards, either the list view, which is what we're seeing here, or a card view, which can be a little bit more visually appealing, and you can save these cards. But again, up at the top, there's just various filters. I feel like it's pretty intuitive as far as building your own. So I do encourage you to check out this tool the next time that you are on the website, and we're always here if you have questions. And then the last tool I wanted to highlight is the option to build a custom report on the website. So these allow you to build these reports based on indicators and then a location of interest. And it's a pretty easy way to just pull together different components on the site into a downloadable PDF that can be used to help tell the story of your community, and again, can be easily shared with others. I did want to just mention that these are static, so it's just a snapshot in time. So if the data is updated on the website, your report will not change like it would in a custom dashboard. So here I have created a sample just to show you. So this is looking at housing related indicators in Ashland County. So you can see that there's just a variety of different text you can add, and then some visuals. So here I've just got two indicators: severe housing problems as well as home ownership. And I was just going to show you where to go on the site to create your own report if you're interested. So you'd go to Tools and Resources and then build a custom report. And you'd be taken to this screen where you would first select a location, and then you would have the option to start adding your different components. I know that was very brief, but again, just doing a very high level overview of some of that data that we have available and the different tools that we also have available. So I'm going to go ahead and stop sharing, and I believe Libby is going to share Dr. Friedman's slides. But as Libby said, we're so excited to have Dr. Darcy Friedman with us today, who's an applied population health scientist and community psychologist from Case Western Reserve, who is going to be sharing about making the food systems in the city of Cleveland more equitable through her work with FoodNest 2.0. So thank you so much.
And let me know, can you see my slides, Sarah? Are you able to let me know where Dr. Friedman? Okay, great.
Yes,
Thank you so
yes.
much. Okay, Dr. Friedman, feel free to take it away.
Great. Well, thank you. And thank you for the overview of the Healthy Northeast Ohio platform. I happen to be working on a project right now, and I'm going to be encouraging people to go there to pull local data to understand their context as they're developing solutions related to food security. So as Libby and Sarah mentioned, I'm a professor at Case Western, and I'm going to share some insights today from a study we've been conducting, and you can go to the next slide, that we call the Modeling the Future of Food in Your Neighborhood study, or FoodNest 2.0. And so this is a collaborative project based in Cleveland, where we've been engaging researchers and community leaders to develop tools that offer a systems lens. So I think that's really important, thinking about the problem of food insecurity as a problem of the system. And then within that, looking at it through an equity framework. So what does it mean to tip that system then to fairness, to advance nutrition equity and racialized neighborhoods? And I use the term racialize to acknowledge that there, through a variety of systems and structures over time, there were areas were identified based on their race as being worthy or not worthy of certain kinds of resources. And the consequences of that are things like disinvestment in neighborhoods and lack of access to resources like grocery stores. But these are a product of a very structured process of racializing those places and systematically reducing opportunity. So if you go to the next slide, just wanted to begin by talking about what is the problem when we say food insecurity. What do we mean? And if you go to the next slide, I want you to think for a minute about these questions. You know, how true are these for you and your family over the past year? Did you worry whether your food would run out before you got money to buy more? Did the food that you bought not last and that you didn't have money to get more? You couldn't afford to eat balanced meals. You or other adults in the household cut the size of your meals or skip meals because there wasn't enough money to buy food. Or you or other adults in your household did not eat for an entire day because there wasn't enough money to eat food. So for those questions, these are actually sample of items included on the USDA food insecurity screener. So whenever you hear measures of food insecurity, they're often coming from responses to these items. Every year, as a part of the annual community population survey, which is part of a census process, these questions are asked, and that's how we're able to get estimates nationally about food insecurity, but then those come down and they inform our local understanding. I want to just highlight, if you looked at these questions and none of them were true for you, that's a great thing. I hope they weren't. But if they weren't true for you, I do encourage you to consider how you would engage people with lived experiences related to food insecurity in the work that you do. You can go to the next slide. So here are some of the latest data on food insecurity in the United States. These are the 2020 trends. Every year, about November, or actually about September, October, the USDA releases the latest update on food insecurity. And some of you may have seen this headline in September, that there was no change in food insecurity from 2019 to 2020. And you can see in this slide, in 2020, about 10.5%, so 1 in 10 people in the United States was food insecure, meaning that they were responding affirmatively to some of those questions that we saw on that prior slide. The USDA categorizes people into 3 groups: food insecure, which is meaning at some point you worried about accessing, having resources to buy food. And then there are more severe levels of low food security and very low. Very low is getting at the point of hunger, meaning that people are skipping meals or skipping eating for an entire day. Thankfully, in the United States, we don't have, those are pretty low, although we still have, almost 4% of the population. I think it's important to note that, this was, of course, the year of the pandemic, 2020. And so we were very worried, and I think probably many of you were, about issues of food insecurity over the past year. So if you go to the next slide, I think it's important to highlight, though, that food insecurity disparities persist. And so what I presented here for you are the data from 2019 and 2020. And the headline was, overall food insecurity rate, no change, which sounds like it's really good news, right? But then if you dig into those data, what we see is there is actually a significant increase in food insecurity among households with children. Those are the most affected by food insecurity. Black and non-Hispanic households, a significant increase in food insecurity from 2019 to 2020. So again, this pandemic effect. But for white non-Hispanic households, there actually was a decline in food insecurity from 7.9% to 7.1% in 2020. And so what that tells me as a researcher in this space is that all of those solutions that we were putting out in 2020, pandemic EBT, drive-through pantries, farmer to family boxes, all kinds of things that were done to address food insecurity, they were more helpful for white families than they were for Black families. And I think what that kind of coming back to the very first thing I said about racialized neighborhoods, that these problems like food insecurity have to be understood in that broader context of what is structuring an outcome like food insecurity in the United States. If you go to the next slide, here is just a high-level look at who is most affected or most likely to be food insecure. These are based on the 2020 data, and I put stars just to show you these high-risk groups. So the most high risk group, and it makes a lot of sense, are people who are below the poverty level. And it makes a lot of sense because food insecurity is really a measure of economics. You heard in those questions, could you afford to buy food? Could you pay for the meal? If you are struggling financially, then you're obviously going to be at much greater risk for struggling to also pay for your food. So that is, one group. If you serve populations below the poverty level, there's a very good chance that they're struggling with food insecurity. Next, if you go up at the top, you can see single women with children. This is a group that likely is also burdened by poverty because when you only have one income in the family, it's going to be more difficult to have the resources to buy the foods that you need. And we also know because of other structures of oppression related to, for example, wage patterns among women, single female-headed households with children may be lower wage households. And then lastly, we do see, as we just saw in the prior slide, that there are these racial disparities. So Black and Hispanic households are much more likely to be food insecure compared to white households or other non-Hispanic households. If you go to the next slide, you can see here's just a summary, highlighting that food insecurity in Ohio is a problem. We came into the pandemic with a food insecurity rate, you can see in this orange box on the right, our rate was 11.6% versus 10.7% for Ohio. And I think importantly that very low food secure, again, these are families reporting hunger, missing and skipping meals, 5% in Ohio versus 4.1% nationally. Although I will share that the latest update, we used to be red on this map, and we are now in the near the average. And so we are showing some signs of improvement, which I think is a good thing. Next slide. So let's take it a little bit more local. And this is looking at Cuyahoga County. Those of you that are in our county are familiar with this map. Those of you nearby are probably also familiar. Right up here at the top is Lake Erie. And the large area, darker area, represents areas in the county that have high numbers of food insecure per 1,000 municipal population. So these are calibrated to size of community. And then the orange is medium, and then the low is the light yellow. And what you can see here, again, those of you familiar with our county, patterns that we see regularly in maps, we have that city of Cleveland and the stretch there to the east and the west of high, surrounded by the medium, and then on the outskirts and more of the suburbs, we have low food insecurity rates. So the important point in this slide, and this is for all of you working in various communities, is that it's difficult to have a county-wide solution to food insecurity because there's such variability. And so what works in Cleveland is maybe not going to work in Solon, for example. But there are people in Solon that are food insecure, and there are people in Cleveland. And so what does that look like in terms of a response strategy? How is it tailoring to local needs? If you go to the next slide, and that's where I think the data that we just heard is really helpful, because you can see, is this a community, like, do they have access to cars? Do they have access to, what's the job opportunity in these areas? So what are the solutions to this problem? And as I just said, there's one size will not fit all. If you go to the next slide, just want to remind us what we've learned and what I started to say at the very beginning, that food insecurity is the result of a broken food system. And in order to solve a problem like food security, we can't just tinker around the edges. We can't just give a little bit more money in your SNAP benefit or a little bit more nutrition incentive, or even build one more grocery store over there. Those are not solving the broader systemic forces that are producing an outcome like food insecurity in our communities. So systems change is necessary to transform those outcomes. And what we, in our project here, the Food Nest project, as we've tried to unpack the complexity of local food systems, we've actually identified that the opportunity for change rests in defining a new goal for local food systems, especially in racialized neighborhoods, to transform action. And we've identified this new goal as nutrition equity, and we define it as having freedom, agency, and dignity in food traditions, resulting in people and communities healthy in body, mind, and spirit. And you know, I've said this definition many, many times at this point, and every time I read it, I'm just, you know, feel like compelled to share that every word in that definition has been identified by our community partners as being important. You know, that it's not just about health of body, for example. When we started our Food Nest project, we talked about, you know, how do we reduce chronic disease? Actually, in our models, that was a variable. And what our community partner said is it's more than that. Like what we eat feeds our soul, it feeds our mind, our spirit. And I will tell you as a scientist, we don't really have a way to measure the mind or the spirit necessarily. And that's actually some of our future work. But I think at a minimum to acknowledge that things like food insecurity don't just address chronic disease. Right? And that struggle that you have when you can't feed your kids might be what spurs something like an addictive behavior. That's like, I just need to feel good about something, because everybody wants to feed their family. And the reality is you can't go very long without meeting that basic need. And you'll have to resort to any means necessary to feed your family. And so this aspirational goal of nutrition equity is shaped by these different dynamics. So they're related to things like fair access to affordable, fresh, and healthy foods. Those are things I think many of us are familiar with, but they're also shaped by things like neighborhood thriving. Are there opportunities to support growth and development in neighborhoods? Or things like social connectivity, particularly related to healthy mind and spirit and political engagement, because many of the factors that structure something like nutrition equity are going to be coming through policy drivers. If you go to the next slide, our team has identified that there are 3 potential targets to center nutrition equity in your work. So you could think about, how are we doing things that help people meet basic food needs with dignity? These are things like emergency food assistance or food assistance benefits. How are you doing things to balance supply and demand for fresh and healthy food? So we all know that saying, if you build it, will they come? I mean, you can build it, but if there aren't food culture and norms for those new products, then it may not be a successful strategy. And thirdly, how do you expand community empowerment and food sovereignty so communities have ownership of these change strategies? If you go to the next slide, some people are like, well, what does that actually mean? Give me some examples. And so these were things that have come up by our partners as opportunities for centering nutrition equity in your work. Again, there's not a single solution for every community. This is about a conversation to work with your partners to see what fits, but it could be something like growing food on vacant land, or it could be something like, how do we have better perishable food recovery systems? Or, as we saw a lot during the pandemic, how do we enhance online ordering and food delivery for people receiving SNAP or WIC? Or it could be job pipelines for people in the food systems industry. So there are a lot of different options on here. And if you go to the next slide, I want to also highlight that those things that are directly related to nutrition equity are important, but that you may also want to think about, how do you do these concurrent efforts, like reducing neighborhood crisis? So in our modeling work, we saw, when a community was struggling with addiction, all of the dynamics are getting out of whack, because that is very disruptive to the system. Or with homelessness or COVID-19, of course, we saw that. How do we expand neighborhood investment for racial equity? How do we reduce other costs? So this is where, what's your parallel work related to childcare costs, or debt relief or reducing transportation costs? How are we subsidizing other basic needs? And then, what's the work being done to increase public participation in policy making? If you go to the next slide, I want to just share with you today, we as a team have developed 2 resources to further community-driven food systems change. Our menu of actions lays out a lot of what I talked about today, but gives you a lot more examples, dives in deeper. It's designed for a lay audience and actually gives you some how-to steps. And then our food systems change vision board toolkit are for those of you at the level of, I want to start to think about what does it mean to innovate around nutrition equity. And that walks you through a process to build out a vision. I will put in the chat in a minute the links to those so you can download them. And they're both free and available. And we hope you would take advantage of those. So go to the next slide. This is my last slide. So just saying thank you so much. It's been great having this opportunity, and I'm happy to take any questions from you.
Thank you so much, Dr. Is fantastic. I'm learning so much about all of these resources and different recommendations of ways to address this. And the thing that I find most fascinating is there are all of these different levels in which you can address food insecurity. And it's not just, as you said, adding more money into XYZ or adding more fruits and vegetables. There are these systemic things that can be done to really address it. And I'm just finding this so invigorating, and I'm excited to hear these different resources. And you did answer one of my questions, which was, where can we get that toolkit that you shared? Because we do have partners in 9 counties across the region. So I think that would definitely be of value to them. But that's great. I'm going to go ahead and, Sarah, are you able to see if there are any questions in the chat box for Dr. Friedman? I'm going to pull up our slides while
I'm
you
looking
are.
right now and I'm not seeing anything. And
Okay.
just a thank you. So thank you again, Dr. Friedman. And yeah, I'm looking. I'm not seeing anything right now, Libby.
Okay, great. I do have one quick question. If there are no questions, then I'll take the opportunity to ask one. In one of your slides, you were mentioning, or actually I could, well, I think I already closed it down, but in one of your slides, you were showing some of the different statistics in relation to food insecurity from 2020 to 2021, or 2019 to 2020. So when do you anticipate that the 2021 stats may come out? I know you said USDA may release around September, October. Is that something that's kind of on the horizon for here?
Yeah, every year they release, so there is an annual report, and typically it's in the fall. Actually, right about now is when they're collecting the data for this year, and then it will come out in next year. So
that's great.
Just stay on the lookout. And again, USDA has very nice resources. I put the references in here, where you can look at and even if you just Google USDA food insecurity rates, I mean, you can see all of the trends and look at historical data as well.
That's great. And then for maybe individuals who would like to have more of a conversation, learn a little bit more about the studies that you're conducting and all of your work, would it be okay if they got in touch with you via email? And I know I had it pulled up on I think I do still have it up. So here we go. Is that okay if people get in touch with you for conversations and greater discussion?
Yes, and I'm also going to put in the chat the link to our website for the Food Nest study. And, you can also, we have a lot of resources actually on this site, and happy to, within this study, we actually have published 13 papers. So we have a lot of good data about some of the trends and really how entrenched these problems of food insecurity are and why it's so important to move to that level of systems change.
That's great. Thank you so much.
And Dr. Freeman, I was just going to ask also while we have you, would it be okay if we shared your slides as a PDF since we've had people who weren't able to attend? Perfect. Thank you. And Libby, again, I'm not seeing any other questions.
Okay. Well, great. We will go ahead. Oh, it looks like I did just see one come through, so I want to make sure that I don't
You're right here.
Close it
out. So we had a comment or a question. How can we get involved with the Food Nest project?
Very good question. Well, we are now, this is a great commercial for what's to come. So we're getting ready to end Food Nest 2.0, and we are preparing for the new study. So in Food Nest 2.0, it was really about a learning, how do we understand these complex dynamics? And as we're moving into the future, we're actually getting a new name. Our new name is called Nourishing Neighborhoods Empowering Community Study, where we will be implementing an intervention called the Nourishing Power Intervention. And its goal is designed to diversify networks of leaders at decision-making tables related to food systems change, people innovating food systems work and being funded to do that work. And so it's a multi-component intervention looking at completely different targets. So we're not going to be measuring food insecurity, every single month, because what our partners have said is you've studied those things long enough and they don't change. We want you to study places where there might be stronger levers to pull. And so that is planned to kick off in March of 2022. And if you go to our website, or you could email me, I can add you to our listserv. We have a monthly newsletter, and that will keep you up to date. Once we have official kickoff for the new project, we'll probably have some kind of webinar or whatever to announce it and share ways to engage. This current study was focused on Cleveland. Our new study is moving throughout Cuyahoga County, although I think there are lots of lessons that could be, shared in other counties.
That's great. Wonderful. This is great information. I'm so thrilled that we were able to have you on today and share these lessons learned, best practices. I'm going to go ahead and pull up our remaining slides. We just have a couple of concluding points. And again, Sarah, if any other questions come through in the chat, feel free to interrupt, and I will be happy to come back to this. But just a reminder to everybody, if you have questions about healthyneo.org or if you have requests, please do feel free to reach out to Sarah or I by email. You can also contact us through the website under the Contact Us page. We do have an upcoming webinar for Geauga County in January. Hard to believe that that's already next month, next year. So we will have some information on how to register for that coming out soon. So if you could be on the lookout for that, that would be great. And then lastly, thank you so much for attending. Again, we appreciate all of the support during this webinar series, and we are really excited for next year to start bringing even more opportunities like this to share and engage with different partners and hear about these wonderful opportunities for health improvement that are happening in our region. So thank you so much, and we hope to see you soon.
Thank you, everyone.